Today, we are honored to speak with Dr. A.K. Manchanda, a highly experienced physician specializing in heart health and diabetes. Dr. A.K. Manchanda has been practicing for 38 years and works at Curewell Diabetes and Cardiac Centre in Bali Nagar, Delhi. He has a medical degree, a master's degree in general medicine, and Post Graduate Diploma in Diabetology. Dr. Manchanda will help us understand what lifestyle is and how it affects our health, especially the diseases linked to our daily habits and choices. So let's begin.
The meaning of lifestyle actually means our day-to-day activities, which involves a lot of physical activities, how much we do our physical activities every day. Desirable physical activity means at least 30 minutes per day for 5 days a week, or at least 10,000 steps per day. While coming to diet should have the good balanced diet, should be proper proportion of diet which should be distributed. We should eat high fibers, full grains, lot of salads, fruits, vegetables, and Indians are particularly, they eat very less proteins, so protein should be taken into considerations. Actually, vegetable sources has very less protein, so we should take proper amount of pulses, lentils. These are important. And from animal source, eggs and fish and poultry, and these provide a lot of high protein diet. Coming to the fats, we should take lot of polyunsaturated fats like sunflower oil or canola oil, and monounsaturated fat. We should avoid a saturated fat like coconut oils is not good, and animal source fats, they are never been considered to be very good fat, and total fat should not be more than 20 ml per day, and we should avoid trans fats. These days all the preserved food, biscuits, pastries, cakes and mayonnaise, etc., they are rich in trans fats that should be avoided. Lot of the non-infective diseases all over the world, they are related to the lifestyle changes. So to narrate a few diseases which have direct implication because our bad lifestyles are: one is obesity, that is the overweight. Second is diabetes. Then it is heart disease, hypertension. In the girls, in the young girls, it is PCOD, polycystic ovarian disease, and there has been found to be association of certain type of cancer which are linked to the obesity, which is again a reflection of the change in the lifestyles. It is very important. It is found that patients of diabetes, if they lose their weight in the tune of 6 to 8%, they can have 1% reduction of HbA1c level. And if they lose their weight by 15%, these patients may go into remission. It is not the remedial treatment, because as soon as they leave, they will get back to diabetes again. But if they address this lifestyle and they bring down their weight by 15%, they can go into remission. There are a lot of studies regarding this. As I told, one of the change in the lifestyle, they can cause obesity, and obesity is the precursor of diabetes, and it is lot of atherogenesis. There is a free radicals concept is there, that if we have poor lifestyle, like there are a lot of free radicals which are generated, which cause lot of atherogenesis. These patients may have lot of hypertension. Salt-rich diets, they can have lot of hypertension. And while we address and ask the patient to change the lifestyle, there is correction of their lipid levels, there is lowering down of LDL cholesterol, lowering down of triglycerides, sudden deaths, etc., they are also reduced, and the incidence of coronary heart disease is also reduced significantly. Lifestyle has been considered to be very important aspect, like if we have a lot of physical activity, so therefore there is our hypothalamus is activated and our immunity is, let's say, boosted. Similarly, eating appropriately high protein diet, avoiding the trans fats, and avoiding the fat rich diets, which causes our immune system to be very strong. They also strengthen our immunity as well as tendency to overcome the diseases. PCOD is a disease of insulin resistance again. The girls who put on their weight, so therefore there is testosterone level is increased, because estrogen conversion to testosterone through fat cell takes place. So therefore the female hormones become less, and their counter hormones become in higher in number. So these have influence of their physiology, which causes the PCOD. PCOD has three elements. One is polycystic ovary disease in ultrasonography. There is a lot of hair in the face, like causing hirsutism, and their menstrual irregularities can be there, which is the skipping or having the early menstruations. So if these girls decide to overcome disease by changing lifestyle and bring down their weight by 15%, these girls will definitely overcome their PCOD disease. There is no need to take any medications. There are certain habits of the patient which they incorporate while some people prefer to have smoking, they have lot of alcoholic dependence, and some patients which are highly morbidly obese, that is BMI is more than 35. So these are the precursor of disease as such, so their claim is likely to be rejected if they are morbidly obese, if they are smokers, or if they are alcoholic or taking any other additives. In case you think that your claim has been rejected despite you're having a genuine reason it to be passed. So first all I will say that one should not be smoker, one should not be alcoholic. If these two issues, claim is likely to be rejected. Second thing, other diseases, kindly disclose completely while taking the policy. Despite these issues beside these points, if your policy is denied, so one can go to Samadhan. This is an institution which works to help patient to claim their policy if policy is rejected due to the technical reasons.